Hello, welcome to my series on protesting Australian psychiatry. Uh, Today I wanted to talk to you a bit about insight and what insight means. Now, everyone, I think, agrees that insight is a good thing, and people like to be insightful and have an accurate appraisal of themselves. However, insights are different from the concept of insight as used by psychiatry and to a lesser degree psychology. In psychology, there are lots of people who are studying the process of having insights, as in creative ideas like when a penny drops, or people say a eureka moment or an epiphany. These are another way of describing insights. However, in psychiatry, insight specifically means acceptance that you are mentally ill, regardless of how poorly justified the label is. Now, it's my contention that a large number of the labels that are used in psychiatry are primarily stigmatizing labels, and that psychiatry as it is practiced is a system of character assassination, because there's nothing more incriminating than to be told that you have a sick mind. Now, sickness means illness, and mind is mental. So mental illness means that you have a sick mind. And in colloquialisms, a sick mind is equated with the most depraved of human beings. That's what you say, someone has a sick mind. But you can't divorce psychiatry as an academic profession from psychiatry as it's applied in society, and psychiatry as a social phenomenon of the last 200 years that emanated from Western universities. Their ideas of what is normal are being applied all over the world. And one of the things that they have applied is this concept of insight. Gaining insight means accepting that you are mentally ill, and lack of insight is people saying that they are not mentally ill. This is enshrined and has been for many decades in psychiatric rating scales like the BPRS, or the Brief Psychiatric Rating Scale, and the PANS, the Positive and Negative Syndrome Scale, which is used to justify all the newer generation antipsychotic drugs. They are based on improvements in PANS scales. Now, the PANS scale includes 30 different criteria or syndromes or symptoms to give rise to descriptions of positive and negative syndromes in schizophrenia. They're statistical tools, and statistics can be manipulated and misused. And there are also many subjective, in fact it's all subjective, the application of the labels, not entirely subjective, but very largely subjective. For example, hostility, uncooperativeness, evidence of mental illness. And then there is the question of delusions, where the belief system of the diagnoser is pitted against the belief system of the patient. So if they are from a different, if they are operating within a different paradigm, or say that psychiatry is pseudoscientific or misguided, or they say that people persecute them, or that the CIA spy on them. These are all different reasons that people get labels with schizophrenia and mania. People with an elevated mood, people who go off the topic when they're speaking. That's called flight of ideas. And at the same time that people are training themselves to have lateral thought, an increase in goal-directed activities through positive psychology, an increase in goal-directed activities lasting more than 5 days is pathologized as hypomania and mania. Now, the treatment for these conditions is drugs, and the treatment for mania was developed in Australia. The mainstay, the main drug that is used is lithium. Now, lithium poisons the thyroid gland in the neck, and it also poisons the kidneys and causes kidney failure. It's also highly toxic in overdose, so they have to monitor them with blood tests to make sure that the lithium level is within a safe level. Now, this was developed by Dr. John Cade in the Bandura Repatriation Hospital in the 1940s. And Cade was experimenting with guinea pigs in the hospital kitchen. The disused hospital kitchen he converted into a laboratory. And he found that injecting the guinea pigs with lithium made them lie on their backs and not right themselves when he poked them. So he thought, oh, this is a great tranquilizer. So he tried it out on his inpatients. And he found that there was no benefit in schizophrenia and no benefit in depression. He doesn't say that whether they got worse or not, but he said that they had dramatic results in mania. So this became the mainstay of mania treatment. When I studied at the University of Queensland, the standard treatment for mania was lithium. And John Cade was in some senior and prominent positions in Australian psychiatry after his discovery of what he called a lucky nugget. A lucky nugget, a gold nugget. I think he made a lot of money out of the psychiatric application of lithium. Now, there are a number of other drugs that they use as mood stabilizers apart from lithium, including a number of anti-epileptic drugs. But the far bigger market is that of depression. And there are many, many reasons that people become unhappy in society. And They have studied it, and bereavement is one cause, breakup of relationships, loss of jobs, poverty, difficulty paying bills, having nowhere to live. And then there are additional stresses within families. And there is a lot of family dynamics that are stressful within particular families. And the hospitals systematically side with families against patients and turn a blind eye to the existence of persecution within families, and scapegoating, where you get a black sheep of the family. The black sheep of the family often ends up in the psychiatric hospital, and the family are then indoctrinated into believing that any time that this child or adult changes and starts talking too much or talking too little, or staying up at night, or going out too much or going out too little, they observe them through this lens of mental illness. And the big focus is compliance, and this is the word that they use, compliance. You're compliant with the medication. They never call them drugs, they call them medication. And you have to be compliant with the medication. And the entire hospital system is obsessed with this idea that compliance with medication is absolutely essential. It's the end-all, be-all and end-all of medical treatment. At the same time, they use this concept of lack of insight to deny people their civil rights. Your right to free speech, and your right to safety, and your right to freedom of action within the law. And you have a right to freedom. You have a right to freedom to live and pursue your goals. And this system selectively picks out the flaws in people instead of identifying their strengths. And many of the psychiatric victims have many strengths which are unrecognized by the system. And instead they are told that they have a chemical imbalance. Now when you ask them what chemical is imbalanced, they usually come up with the serotonin theory of depression and the dopamine theory of schizophrenia. But these theories happen to be very convenient excuses by the drug companies to market drugs that affect serotonin and dopamine. Now, I have written extensively on the dopamine theory of schizophrenia and the faulty logic of the chemical imbalance theories. But the label of schizophrenia that people are supposed to gain insight into was developed 100 years ago, in 1908, 110 years ago, by Eugene Bleuler in Switzerland. He was a professor of psychiatry. And Bleuler said that his patients in the Bergolzli clinic didn't fare as disastrously as those of Professor Emil Kraepelin at the University of Heidelberg. Kraepelin called his young people who heard voices, his patients, he said they had dementia precox. Now, when I was in medical school, we learned that Emil Kraepelin was the father of psychiatry, and we learned a basis in German psychiatry. We also learned about Bleuler, and when I was first locked up, I was locked up in the Bleuler ward of the Royal Park Hospital. And Bleuler and Kraepelin were both eugenists. They were scientific racists. And they believed in the supremacy of the white race. Nazi eugenics arose from the psychiatry profession in Germany embracing the British tradition, the British doctrine of eugenics, which was developed by Charles Darwin's cousin, Francis Galton, in the 1880s. And Francis Galton set up the first eugenics society with Charles Darwin's son, Major Leonard Darwin. And the first vice president of the eugenics education society was none other than Winston Churchill. Right? This was long before the eugenics spread to Germany, and Germany implemented what they call mercy killing, and the Action T4 program, and started killing off mental patients to clear the asylums, and supposedly improve the heredity of the German race. So insight, I think, means having an ability to look critically at yourself. And it has nothing to do with accepting Nazi labels for yourself, and the belief that you have chemical imbalances and subtle brain abnormalities. The brain abnormality that I have right now, where I'm having difficulty pronouncing complicated words, is a direct consequence of injections that I'm being given against my will for the treatment of supposed schizophrenia. And I know enough about the history of schizophrenia to question the application of this label to anyone. That's not to say that people don't hear voices. There are people who hear voices. And some of those people are happy to accept them, the voices. Some of them learn to control them. And some of them prefer to take tablets to control them. That is not the same thing as a person who believes that the corporations are corrupt, or a person who believes that in reincarnation, or a person, for that matter, who believes that they're the second coming. These are all different belief systems that all get lumped together as schizophrenia. People who believe in telepathy. or people who experience what they believe to be telepathic experiences. These are also lumped together with schizophrenia. People who believe in magic and spells and the occult. That's another reason that they get called schizophrenic. People who believe in New Age religions. There was a big spike of young people who believe in New Age religions in the 1990s. And it's a dynamic process, and it's applied in different countries, calling people mad. But it's all left up to the psychiatrists to make the judgment about who is sane and who is mad. And they are indoctrinated in their training to look with a jaundiced eye at other human beings. And this question of insight hides a multitude of sins and violations of people's human rights. So I'm urging psychiatrists and health workers to think twice before they accuse a person of lack of insight just because they don't think that they're mentally ill. And imagine what it's like to be called mentally ill for your beliefs. Apply the same principles to yourself as you apply to other people. Thanks for watching my little rant about insight.